principal of Agriculture CEC.
In Homa Bay County.
Yes.
This one is after the fallout with the governor.
Yes.
But that was expected, I think, although it's been affected very, very fast.
Yeah.
Yeah?
Yeah.
But I'm just wondering, are people, when you're serving in the same government, your opinions in political opinions, do they matter that bad if you're of a different
persuasion?
Yes.
You see, these guys were elected on one ticket, but Owiti Magwanga didn't support Gladys.
Boyd Were?
No, didn't support Gladys to be the governor. It's Raila Odinga who told him to support Gladys so that, because if Owiti had gone solo, Gladys would have not won the seat. Definitely. So now, and remember, Owiti Magwanga was the MP for Kasipul for a very long time.
For a long time.
So now he has the right to support someone he wishes, because that was his former constituency.
And he's been strong on the ground for a long time.
Even now, he's very strong. So I think maybe Gladys Banga is biting more than she can chew.
So are we almost seeing like preparation for a face-off between the two of them?
And it can be one term.
It could be a one-term case here.
It will be one term. See that one term they're singing?
Yes.
Even them, they pray for themselves for a one term. Yeah. So if you know that Owiti Magwanga is not a pushover in ground politics.
Yes.
Yeah. And remember, this Aroko guy didn't even have a party. He was an independent candidate.
He's been an independent candidate.
Yeah, who pushed them to that level.
Yes.
Yes, and the Raila factor wouldn't be there.
So are you saying that are you sharing the same narrative like other people that are saying that Raila Omolo's death, he took off with so many other political orphans?
There are many orphans.
Good to be expected.
Yeah, of course. Some people will go, have to go, must go.
Yes.
You know, you used to say must go.
Must go.
Yeah, now must go.
This is must go.
Yeah. We used to call him must go.
Yes.
It's not him now.
Yes.
The other people are must go.
Yes, must go. Okay, it's good to see how the political scenario will be shaping, especially as we get towards 2027.
The question I have for Gladys Wanga is that character who used to work as his chief officer was beaten on allegations which were unfounded, all that.
Yes.
Did he help him?
Big question. No. The answer?
Yeah, so Gladys,
yes,
as you are busy kicking people out, please look for that guy called Charles and make sure that he recovers.
That's true.
Otherwise, your name is not, the people of Homa Bay will not forget what happened to that man. Yeah, so
that's true.
We are telling you also. Yeah, it's important to be told.
So you don't just kick out also, fagia kwako.
Fagia kwako kwanza. Don't fagia kwa wengine. Yeah. Where is Charles? Yeah, that's a question.
That's a big question. Yeah.
Where is Charles, and did you replace him, or is he being taken care of?
Yes.
Yeah. So back away from political issues, Solo, I think we have a gentleman in the studio, and it's important we are unpacking very pertinent issues on disability and issues about people who are living with disability. And he promised us that he'll tell us his personal journey.
His personal journey.
Yes.
Yes.
Yeah. Okay. Thank you. Thank you. My journey has been quite interesting because being born from the Luya community and having a brother with a disability, elder brother with a physical disability who uses a walking stick, and having seen the models of disability being explained or coming out through the raising of my elder brother, it was such a touching experience because that gentleman underwent what we call medical model of disability, because when he acquired disability out of polio, at the age of 3 years, I could see my parents struggle to rehabilitate him, take him through therapy and so on. And up to now, at times I see the customized shoe that they tried to use on him to see if he can be able to walk on it. Then he moved through the hurdle to access education. And like many other public schools, the primary school that I went to, and it's the same school he went to, was not really accessible. Yeah, so the teachers also and fellow pupils then didn't have the etiquette, the demeanor to handle persons with disability. Not only him, but quite a number of others, because I had a classmate from class 3 up to around class 7 who had also a little bit severe disability, and the mother kept on bringing food every lunchtime as we went home running for lunch to eat lunch, then come back home. This gentleman couldn't run home and come back, so the mother, who was like a caregiver, and then I saw the hassle taking him to school, and and he had a challenge even to access the toilets, simple pit latrines that are back home. So you can imagine, he can't eat too much so that he doesn't use those services. Yes. He has to regulate himself because they are not accommodative to that. And I think he couldn't continue past the primary school because of the same challenge. Yeah. So personally, I was somehow privileged because of the ability that I have to access those education very well. And then join high school, passed, went to more universities, my university, where I did project planning and management. Then I went for the master's program in the same university to do development studies. And during the undergraduate is when, immediately the undergraduate is when I was employed to work with the Gender and Disability Development Center. And I've worked in that center and moved up from programs officer to now the director of the center. And because of the good work, running from 2011 until now, working on disability and gender matters, I think someone saw my good work and nominated my name, seconded my name to the principal secretary, the Minister of Labor and Social Protection, where I was appointed among other members coming from different government institutions and also organization for and those of persons with disability to serve in the National Interagency Coordinating Committee since 2018. Yeah. So that Interagency Coordinating Committee has exposed me quite well because we had now the responsibility as committee members to ensure that we bring out the policy and legal framework for the country, revise the persons with the disability law. We revised the 2003 law to the 2025 law. We were also had a key term of reference on coming up with the policy. That is the persons with disability policy, the first ever national policy that guides now other institutions on how to also domesticate the policy from there and address matters to do with the disability. We also responsible for ensuring that all sectors of development do not leave behind persons with disability. And with that, we can comfortably see the progress on the employment sector, the employment quota for persons with disability. We can comfortably talk about financial institutions, how they're supposed to accommodate persons with disability. We know that traditionally things such as the ATM machines, the Pessah platforms and so on, for person who can't see and those who are using wheelchair, they cannot access those some of those platforms. So we have the responsibility to come up with those interventions. When we're having post-election issues, like the one we had even recently and the recent past, you find persons with disability are not able to democratically, within their rights, participate in elections, vie for posts, and also participate in the voting and the aftermath of the elections. And whenever we have violence that comes with that, they're also the most affected.
Most vulnerable.
Yeah, they are the most vulnerable. So we have quite a number of programs with that within the humanitarian interventions and within the conflicts situations.
Okay.
So it has exposed me to that, and I pride of coming to age in participating in the transformation of the inclusion agenda in the country, because I feel I'm at the apex.
Yes.
Because serving at the national committee level, ensuring that we guide the policy and further narrow down to domesticate the same policy is a good achievement, and it's work for humanity. Most of this work, again, we not like paid for it, but there is a passion that drives that, having experience and seen what persons with disabilities face.
Great.
Okay. So you've talked about inclusivity.
Yes.
And the journey also touched a lot about how big inclusivity and gender is. And today is the month of GB, gender, fight against gender violence amongst people and homes. So maybe you touch on GBV and the levels of it, because this is still weak for it.
Yes.
And also, what is the level of inclusivity by the years?
Okay, thank you. We running the 16 days of activism, the way you say. And GBV has been with us, not only in Kenya as a country, but they say globally there is no country, even the most developed one,
that doesn't face that.
That doesn't face GBV. So the Western countries have like a prevalence of 25%. The highest is within the Middle East. Yes, Middle East has the highest prevalence of GBV, even more than in Kenya. It's good to mention that we have data that says in Kenya, GBV is more prevalent in Bungoma County.
I understand why.
Yes, it's more prevalent in Bungoma County. Data says it is less prevalent in Mandera as you come this side. Few cases in Kitui. But again, they say because of that masla arrangement within the that northern part. They embrace conversation that if there is a GBV, you can't report. You go to the elders and they are able to agree and so on. Then kuna kanyagia. But when we see across the country, GBV cases has been on the rising, and it is across board. They say from the age of 40 going up, people are experiencing more GBV. Yes. Yeah, especially within marriage arrangement. Most GBV are perpetuated by people known to the victims. Mainly the partners or ex-partners and so on. And with that data, then it means we're able to narrow down to interventions. And we also know the region, so that we have focused interventions in different region. We also know that although we have more GBV towards the female gender, but we also have cases where the boy child have also faced real-time GBV. I interacted sometimes back with the FIDA institution. FIDA mainly was established to address matters related to GBV and also women-related interventions. But I was told again, we have quite a number of women who are reporting to FIDA more than the men around GBV cases. So those programs are there, and as we move towards the end of, because it is running until maybe 8th of December or something, 16 days of activism. It is very important for all of us to address GBV not only at the workplace, but also where we're coming from. We've seen our colleagues, maybe even here at Spice. You can find a colleague who comes with a black eye. Anasema nilianguka na pikipiki. Another one, another day. If you narrow down, it could be a GBV.
Yes.
Yeah. So we encouraging people to have a mechanism of reporting GBV. And for institutions, they say you don't have one point. If you have a gender officer, if you have HR, key also any avenue of reporting to directly to the CEO, because GBV cases are everywhere. And that if your neighbor is undergoing GBV, make noise. If it is persistent, report to them. You'll go a long way in protecting a loss of life than waiting until you are told that that lady or that man was killed, was eventually killed. So let's embrace it. We should talk it in all places where we are, in church, in chamas, and also when we're having mbogi, we discourage cases of GBV, because GBV perpetration have negative effects to our GDP. A person who is undergoing GBV will not perform very well even at the workplace.
That's true.
Coming with a red eye, they'll be isolated. Then even they don't feel like going back home and so on. And a lot of time that could be productive is wasted. So let's continue talking about it. Let's wear the ribbons if we have the pink one and so on, as we discuss matters GBV and address them.
And maybe sorry.
Inclusivity. Then we solo can ask.
No, I just wanted to well, you talked about caregivers, and especially now, so that you've given us your background where you have actually had it front hand growing up with a brother with a disability. And caregivers are a very important part of their everyday activities and life.
Yes.
And of course, there are different levels. It's very common. There are different levels of people with disability.
Yes.
So, do we have any provisions for accommodating caregivers? Are there any incentives that are given? Because, as you said, they don't do it for the money.
Yes.
They just do it part of charity.
Yes.
Do you have stipends, anything that can motivate them, caregivers who are taking care of persons with disability, and how do you accommodate them?
Thank you so much. Issues around caregiving and personal assistance is very important. First of all, we need to appreciate that the past 5 years or so, the government has deliberately, within its framework, the public service, has allocated a personal assistance or caregiver allowance for person who supports employees with visual or wheelchair users impairment, a standard 20,000 monthly stipend for them. So that is okay, because it recognizes those efforts. Now, those are very few, because very few persons with disabilities are within the public service. So many of the caregivers are within our households.
And
recently we had a survey for caregivers and personal assistants of persons with severe disabilities, and the support system that they require.
Yes.
So one thing that came out clearly was that caregivers are supposed to be given monthly stipend, just the way the elderly, the orphans and persons with severe disabilities are getting. It's a little 2,000, but if you pull it, they will feel it.
Yes.
Because it goes a long way in, of course, cushioning them.
Yeah, a lot of it.
Yes. So we have that program. The survey actually has supported that we need slightly over 10 billion out of the coffers that should be allocated to caregivers.
Yes.
For them to get reasonable support. As you see, and it could be more. It requires a good plan and good budgeting for the same. So if that is to go by, and with support of the Persons with Disability Act, which also has the same provision that the government should come up with modalities to effect support of the caregivers, we're going to address that concern that we have. Because as it is now, persons with disabilities stipend. At times it's ending up in the caregiver's pocket.
Yeah. Okay.
Yeah, because you can't support them and you're going hungry.
That's true.
That is an arrangement that is there. And we hope it goes a long way to address that need as demonstrated in the survey. One of the main theme for this year, International Day for Persons with Disability, is fostering inclusive societies. We have countries where we have programs to foster adoption of persons with disabilities. Fostering is taking a person with a disability. If I have, I'm okay, or I can have some spare money, just to foster a person or a child with a disability and ensure that I move with that child until they are independent, are able to live independently. So that is what we're going to have as a conversation, especially during this International Day for Persons with a Disability, a day from today. And we're going to see whether we're going to run that program and bring together association that will be formed as association for foster.
Yes.
Foster parents of children with a disability, or foster units or institutions for persons with disability. Of course, within this institutionalization, because again, we don't want that nyumba ya wazee kind of arrangement, where you bring persons with a disability to a home. A children's home for persons with disability. We want them to come out from the home so that they are included in the society. The best way or the best approach is to foster, to adopt at least persons with disability who need us. And it has happened in many other countries. And it has worked well. When you adopt one and you see them succeed and begin to live independently as a foster person, you live a happy life even after that.
Nice. I think Solo, another one.
I just wanted to know, because this one is something that is affecting the nation. Why Lodwa? Or are you doing simultaneous activities throughout the country?
Yes. The International Days for Persons with Disability has been in Narok.
It moves.
It has been in Kisumu. Last year it was in Bungoma. This year is going to Lodwa. We're having challenges because travel to Lodwa is not easy.
It's not easy.
So the number will be slightly lower than the one that was in Kisumu. But it is a rotational aspect so that we have a feeling of counties, of all counties when it comes to the celebration of this day. Another thing is we have what we call intersectional approach. In this, Lodwa is within the ASAL institution. And if you are a person with a disability and you are an ASAL, it means you have double
too.
vulnerability.
Yes.
Yeah, clearly.
Yes. So we want to bring it mashinani, and we want also to see institutions that are of goodwill, that are there, that having intervention programs for the ASAL community, either on poverty, on disaster, drought, and so on. When they are having those interventions, they have very clear consideration of persons with disabilities within those interventions. So it's like taking the services awareness program closer to them. Lodwar doesn't have a program like the one we have in Wajir. Wajir is, I think, one of the counties, if it is not only the one, that has a program like the government program of the monthly safety net.
Okay.
Yes. Wajir County has a fund supported by the WFP, World Food Program, where on monthly basis, persons with severe disabilities get, I think, 6,000. You remember, like what was in the manifesto of Raila? Yes, that all people that don't have an income should get that 6,000 as a stipend. So we have that program, and it has demonstrated to really have a good effect on economic empowerment of persons with disabilities or households with disabilities. So we taking those initiatives to Lodwar, so that as we talk up with the persons with disabilities within that, the CBOs that are running programs, community programs in that county, they have an edge on what to do.
Yes.
To support or to have interventions for persons with disabilities. We also have tomorrow we have sensitization program on the law, the Persons with Disability Act and the National Policy of 2024. That one is also very deliberate. Yes. Because persons with disability themselves, they don't know their legal rights. They don't know that they have some legal provisions that guarantees them or to access or any other services, just like any other person who doesn't have a disability. So Lodwar could not have gotten that chance to get that awareness program because UDBK, that is United Disabled Persons of Kenya, has developed a simplified guide of the law. Yes. Specifically for persons with disabilities to understand the law. Yes. Yeah. But now maybe they don't have the capacity to take that guide to Lodwar. Yes. So this
we bring it close to.
This will bring it closer to the people, the champions of disabilities in that county, and also to the neighboring county. Because at Lodwar you'll find the neighboring counties also coming because it is closer to them, and being able to get some of these programs in first hand. And also we'll be able to, it's like we're linking up the persons with disabilities and the potential partners that will now have at least a snippet of the reality on the ground as an ASAL community. For chances of them now continuing to work together in the future.
Are you also obligated to people with disability from families who are facing stigma? A lot of them are seen like outcasts. Some of them face rejection even from a very young age. Some families want to